This part of the podcast does talk about suicide and other topics which could be triggering for some listeners. If this is triggering for you, please refer to the free drop-in centre or go to resprevention.com.au for a list of resources and 24-hour help.
Okay, so you notice we've opened up the front door here. When you come in, you can either put your phone on the QR code and fill in our form, or come and do it on the iPad. For now, we're using this as the entrance to the mental health drop-in clinic until we can sort out something else, but we'll show you the door that we're going to be using eventually. So come in, wash your hands, do your sign in, and the girls will direct you around the corner. So eventually we're going to get a bell or something on this door and people will be able to enter here. Again, scan your QR code so you can sign in, and we're going to put a wall up here so there's a bit of privacy for people, and obviously can have people sitting up here waiting. So post-COVID, or if you really want to maintain your privacy, we'll be able to provide you with a phone number to contact whoever's on the clinic, and you'll be able to access this door. It'll be blocked off here for privacy, and then you'll be taken into this room here, which is our new mental health drop-in clinic. And look, we have a patient here already on the psychiatrist's couch. So we've tried to make it as friendly and relaxed as we can and welcoming. We'll have someone sitting here initially for between 9 and 2 Monday, Wednesday and Friday, and we'll get a bit of an idea about what the best days are and then work out when we should stay open permanently. We're just sort of trying it out in this COVID time when we've got a bit of control over what's happening. And then we hope to have it going 1 day a week permanently. We also have them going down to the school 1 day a week as well. Okay, so don't feel as though you can't bring your children in. If you need to access mental health services quickly, we've made provision for kids to come with you. And our social workers and mental health nurse are used to working with children in the room and can keep things that need to be kept from little ears away from little ears and keep the kids entertained here. Even big kids. Yeah. We've tried to make the room as unclinical as possible. Obviously we have to take notes and keep records and access some things on computer, but really you can be as formal or as informal as you like when you're here.
So the question I had was, so with the clinic, we have 2 people employed, so Billy and...
We're using clinicians that we have here, and we just happen to employ a mental health nurse.
Yep.
And we have a fantastically experienced mental health social worker at the moment who's agreed to stay on.
Yep. Beautiful.
Which is great.
Yep.
And Esther will also be involved in this, but this will be if the others aren't around. So she's an experienced social worker as well.
Yep.
Yeah.
So with this clinic, should people, I suppose, expect to see a different face every time, or?
They might, but the aim of this clinic is like an emergency, like a triage.
Yep.
So we wouldn't expect people would come here for long-term things.
Yeah.
What they would do would be referred into one of the clinicians to see
Yep.
on a more permanent basis.
Yep.
So whoever was doing the intake, it might be them that sees them in long term.
Mm-hmm.
It just depends. So if it's Billy's, as well as having 30 years in mental health as a mental health nurse, she's also got a focus on alcohol and other drugs. So
Yep.
if someone came in, for example, that had issues with addiction, they might be referred to Billy for more longer term care.
Yep.
There might be children that might need to be seen, and one of the clinicians might be more experienced with children.
Yep.
Sometimes...
So it's case-by-case basis, really?
Sometimes someone might want to see a female, so females often want to see a female counsellor, so that would be to Esther. But we're hoping that what we can do is refer people who come to the drop-in centre to appropriate places. We're also building our relationships with Mildura Base Hospital Mental Health Services as well. So we have a visiting mental health nurse who comes here a few days a week.
Yep.
And so we're building some referral pathways with him as well.
Yep.
So the more chronic mental health illnesses he looks after.
Yep. Beautiful.
Well. But today they're working together. That's where they are. They've had to go out in emergency.
Yep. Which is good.
So, and you'll be pleased to know they had 2 people come in on their first day and 2 today.
Beautiful.
Yeah, I called Anthony.
Awesome.
Being played out.
Yeah, I suppose that was going to be the question. Has it?
Yeah, it has. And the other thing, when this office isn't being, because this will be permanently set up as the drop-in clinic, and it's not being used for that, it can be used for mental health consultations anyway.
Yep.
So.
For the well-being of the community and everyone's well-being, you hope that you're not flat out all the time, because there's obviously a major issue. But it's a service that's available, and you hope people are utilising it if they need to.
Yeah, that's the whole idea, that someone and make the decision they want help and they can come straight away and get it. Unfortunately, we're never going to be able to offer a 24/7 service, which would be amazing.
Yeah, it's not even available in the bigger centres like Mildura.
Yeah, that's right.
But we've got good referral pathways.
Yeah. So, do you want me to introduce? We've already introduced Anthony, haven't we?
No.
Haven't we?
Well, not on this podcast.
So, what's your role here? You're a...
I'm a general social worker for the hospital.
Yep.
And also mental health clinician.
Yes. Beautiful. So, Anthony's his name, everybody. So, I suppose just a bit of my background, talking about what I wanted to do. I said it to you before, that I wanted to raise money because I was in a good headspace, I guess, and do a bit for the community and give back and try and help others that are struggling. And Jade and I came up with the idea to run a marathon. And I was going to try and raise $4,200, which I thought might have been capable in a year's fundraising, and send it to Beyond Blue or an organisation like that. But I suppose our concern was, how do we know it gets back to our community?
Yeah.
And then I spoke to Quentin Norton, who was on the board of the hospital at the time, and said, "This is what I'm thinking. Is there anything that the hospital could help? Could I do something for the hospital maybe?" So I think he took it to a meeting, and they sort of came back with the drop-in clinic.
Yeah.
And for me, it would really, I think Jade and I both went, "Yep, absolutely." Didn't even think twice about it, because I've always had an issue with headspace. I think it's great. It's a great service. Don't get me wrong, but after 25 years of age, you basically, without being harsh, you get turned away.
Yeah.
So there was nothing for that older demographic for a basic drop-in where they might, whether it's a crisis or just, in the way I see it, hopefully if someone wants to use a service like this, they can come in, just maybe even have a chat.
Yeah.
Sit here like we're doing now, have a chat about life, footy, whatever.
Yep.
Give them a better perspective of what's going on, and they might be right.
Well, I can tell you now that we haven't officially opened it, but we've been running since Monday. This Monday.
Yep.
I saw 2 people on the Monday.
Yep.
Straight up walk-ins.
Yep.
Right. And as a result, I saw that couple again today.
Yep.
As a formal assessment. And I've got the other person I saw on Monday coming back again today for a follow-up.
Yep.
And that's
Yep.
It's worked. I mean, it's only word of mouth. I put posters and stuff around, but they found out about this by word of mouth. So
Yep.
good effort.
Which is
much
good.
better.
And it's all over the podcast, yeah. No, and that's a good thing. Like, it's unfortunate that you need it. Like, I suppose a good day is if no one comes in, because hopefully people aren't needing it. But reality is people need a service like this.
People are needing it, and it's really responsive. And I know Esther, my colleague, she saw a couple of people here today as well. So it's kind of like it's what I possibly feared it would be. We'll get too busy.
Yep.
But it's working. It's only been Wednesday, day 3.
Yep. Brilliant.
So
so I suppose all that running and that I've been training has been worth it. And all the late hours that Jade's put in with
absolutely
promoting it and raising the money has been worth it.
Well, I don't know of another health service, be it health or mental health, that you can actually just walk into and speak to someone straight away.
Yep.
Usually at a mental health clinic, it's an appointment and it's a couple of months out, and if a person's in crisis, crisis are not time.
Absolutely not.
I'll come back in 2 weeks and have my crisis then.
Exactly.
It's not
it
how
doesn't
it works,
work on a timeline, does it? And the thing I like about it is, it's, at the end of the day, it's free.
Yeah.
And being in that situation, I know what it was like to worry about money and go, well, I need to go and see someone. I can't afford to see anyone.
Yeah.
Because unfortunately, things like psychologists and and serious treatment cost a fair bit of money.
Yeah, it does.
And a lot of times it comes out of your pocket. So the fact that a service like this is free for anyone, and it's non-discriminate, could be kids, could be adults, middle age, doesn't really matter, male, female, whatever it is. So I think it's amazing. I really do, and it's definitely needed.
Well, I'm pretty, like I said, I've worked in health for a while, and I haven't seen a clinic that actually has been set up like this, and then it's like you beauty.
Yeah.
And the range of therapies that both Billy, Esther and I can provide are really broad, so it's not just to come in and have a chat to us and, oh, dear, how sad, it's actually really engaging.
It's not a token pat on the shoulder.
No, it is, truly professional therapy. So.
Yeah. And I suppose, you're right.
Oh, just after someone sees you here for initial consultation, like at the drop-in centre, what to go from there? Like, do you see them yourself, or would you refer them on to someone else, or?
Depends on what the issue is, but being a generalist, we cover a fair bit.
Yeah.
Also do a lot of trauma work as well.
Yep.
We do a lot of EMDR here, eye movement desensitisation and reprocessing. Right, let's just say they turn up at the door and you'll just, depending on what the issue is, it might be someone wanting to know, look, I'm stuck with Centrelink, or somebody I know who's suicided and I'm not coping with that. Yeah. So what you'll do is you do an initial assessment, and you'll do a needs assessment, what the issues are, and probably a triage rating about how serious it is and how critical the follow-up is, if at all. Someone turns up, they're having some problems with Centrelink over the phone with the MyGov website. Might be a case of just go down to the resource centre and catch up with someone down there, and it could be as simple as that. Or it could be that a loved one has suicided and you deal with that, whatever that looks like. And that might most likely, just an example, I would probably book them in weekly or twice weekly, as I thought.
Yeah. And it could be with you, it could be with Billy, or could be with Esther, or?
I would prefer that if I do the initial assessment, I'm the one who does the follow-up. It's just not, the continuity of care is just not there. And essentially,
so if I come in and I'm struggling with work,
I'm
a paramedic, I think most people know that, and I'm struggling with work and dealing with jobs, I come in and have a chat to you. I'm going to be seen by you as follow-up. I'm not going to be pushed around, because I think that's a bit of a problem that people have. Like, they get pushed around. Like, they'll come and see you and you'll say, go see someone else.
It flies in the face of what good therapy and continuity of care is.
Yeah.
Right? If you've told me a pretty serious story, which most people who turn up here do, they don't want to be telling it again.
So what is the process when someone turns up and needs to come in here?
Yep.
So what we've been through with Anita, obviously the location and where to go, the front door, and
look, it's pretty simple. If the door's open, just come on in. If the door's shut, just take a seat outside or hang around. If the person feels they can, just either drop their name in at reception and we'll contact them when we can. So you'll just turn up. If I'm sitting here, it'll be a case of you'll be certainly greeted and things like that, made feel comfortable. And just sit down and basically have a chat and yarn and see what's going on for the person, see in what way can we help or not help, or refer to, or something like that.
So is there a set, and I would hope not, but there's no set time limit, like you're not for a 5-10 minute consult, it's however long the client needs?
No. As a rule of thumb, I would see someone for about 45 to 50 minutes. And then after that, the person's either completely exhausted. Look, I've had cases where a person turns up at 9 o'clock and I haven't finished dealing with them until 5. It can be that serious for people. They might need to have a formal mental health assessment. They might be there's so many reasons. Someone might just want rocking for 5 minutes. That might all it might be.
And that's what, and I've said it before, I keep saying it, that was always my vision of what this drop-in clinic would be, that they might just need a quick chat just to effectively rebalance and confirm that their thoughts are not bad,
they're not going mad,
good, or they're not going mad, or it's okay, they'll be fine, or you can treat them and potentially refer them on to where they need to be. To get
rule of thumb is if a person says that they think they're going mad, well, they're not, because they're actually, their judgment's intact.
Correct. I think what we want the people out there to understand too, that they're not being a hassle by coming in. And I've had that mindset. I don't want to go and trouble them with my dramas, or I oh mate, yeah, I'll be right. Sort of that mentality. You want people to go, you know what, maybe I'm not right. I'm actually not a burden on these people. This is what the service is here for.
Yeah.
Drop in and, you know, you're not going to get told, oh, you're just being stupid, go out, on your way. You know, there is a reason why people are thinking and feeling the way that they are.
Problematically, though, is that when a person does, they've probably been thinking they've been needing some help for ages.
Yep.
Then all of a sudden their drinking increases, their relationship with their husband or wife or kids goes to pear-shaped, their employment gets questioned. They probably lose their licence, they're probably not sleeping properly, probably not eating properly.
Yep.
And that's big crisis time. That's when people, it's beyond the point of we need help. You needed it 2 years ago.
Correct.
So if we can get people to think that, all right, look, this isn't working, I might need to get in there quickly.
Yeah.
But, you know, that level of internal crisis is that people don't, if that's not their internal language, they don't understand it.
Yeah.
They're just reacting.
Yeah.
Which is really problematic. But, you know, we'll happily see anyone.
Yep.
If you've got a partner or a child, can you come in and like have a chat with you, and then like just to without that person, like so just say like I had a partner or a child that I've needed a bit of help. Can I come in and just have a chat with you?
Well, that exactly happened today and Monday.
Yeah, I don't know Luke's situation exactly, but I could see that Jade would have to kind of convince him to come in if he was feeling down and didn't really want to come in. So.
Yeah, it happens. Absolutely. Yeah.
We do outreach as well.
Yeah.
If a person comes to us who they're very concerned about the welfare of their loved one, then professionally I can make the decision like I need to see this person.
Yeah.
Or I can be medico-legally bound to see them.
Yeah.
Right? If someone says my wife or husband's actively suicidal and they're at home and this is happening, well then I will actually.
Because I know, like we get called as an ambulance to places like that, and obviously we're not trained to your level.
Oh, don't go that far. No, nothing to push about us.
No, we're not. And
the ambulance Victoria I've dealt with have been. I'm not blowing smoke in your trumpet, but the ambos I've dealt with have been absolutely superb.
Yeah.
Really, really good. It's just normal.
Yeah, it's good to know because we do feel like sometimes we're not doing enough because.
When's enough?
Yeah, exactly. I suppose. Yeah.
Don't overthink that one, Charlie.
Yeah. Well, I like the chairs before.
Yeah, I'd overthink it, Charlie. Yeah, for sure.
On that note, do you want to put Charlie on the couch?
Charlie, come take a seat, my friend.
We got kicked out of the room and left Charlie with Anthony for a chat. After a while, we were let back in when it became apparent that it really does affect Charlie's life.
Yes, Anthony, it does affect my life in ways. Like physically, I'd say, you can feel palpitations and I feel like my blood pressure's rising.
Right.
So at work, because we do go to, you see farm animals and stuff like that, I've kind of got around it so far, but also we have big bags that we can put in front of us.
Right. So just coming back to it, so when you see an animal of some sort, it basically gives you a fright. Is that what you're saying?
Oh, no, not all animals. Just mainly feathered ones, birds.
Okay.
Yeah.
Right. I've never heard of that before, but I'm happy to go with that. So essentially, if you feel your heart rate go up, your blood pressure rise, do you get sweaty and anxious and
more anxious? Not so much. I don't think I get sweaty.
Yeah. Okay.
It's more anxious, I suppose.
And what do you do to de-escalate that? Because that's a horrible feeling to be in. It's like it sets up I'm out of control.
Luckily, if I'm on a job, you've got something to distract you.
Okay.
Which is the patient.
Yeah.
Which is good. But if say at my mother's or something like that, she has chooks, I just don't go there.
Yeah. Okay. So you avoid them.
Yeah, pretty much.
So does that mean you avoid your mum?
Oh no, she's got them locked up, or in a cage or in little walking around. I wouldn't avoid my mum.
More out of interest, why the fear of chooks? Or feathered animals? What started that off?
Well, like we said before, I reckon like when I was young, I don't know, I just never liked being around them. And then we did have one scary rooster.
Yeah.
Okay. But the way I can remember, I reckon maybe I was scared of him before the rooster.
Okay, so something that's happened that you've forgotten about?
More than likely.
Okay.
So.
okay, well, that sort of sets up a bit of a difficult situation because it's like it's either something you can remember that's impacting you,
Yeah.
or we've got to be careful we don't invent memories. That's all.
Yeah.
So maybe it did, or maybe it didn't. I'm not.
Well, yeah. So yes, we did have a recent one that was just annoying, and it used to, like, as soon as you open the truck door, truck house used to take you.
Yeah. Yeah.
But also, my brother and more my brother, we used to go together, and he's fine.
He's all right.
Yeah.
Well, something in you. I'm just wondering, when you were little, did something happen that really scared you when you? And this thing's going here, because roosters do attack and they don't stop.
Yeah. Well, I don't think I was, like, it didn't, like, jump on me or anything like that, but it's just the fact that I can always remember opening the door and it being in there, coming at you.
So essentially you felt very, very scared by this thing, very frightened by this thing.
Yeah, and maybe I was way too young to process it myself.
Maybe you were.
Yeah.
Little kids don't process trauma.
No.
Really? They behave it, they act it out, or what it might be, and as they get older, they avoid it.
Yeah, well, that's what I do.
Yeah, okay.
Then we got kicked out again, but Anthony had an actual suggestion for a possible solution. Hooray!
Have you got a vision or a memory there?
Oh, yeah, of a rooster coming towards me.
Yeah. Does that scare the shit out of you?
Yeah.
Come and see me, we'll do some EMDR. We'll get rid of it.
Alright.
I'm serious.
I still don't want to touch the truck, though.
You don't have to. But we can get rid of the image.
But maybe by the end of the therapy, he'll want to. The clinic is currently available to everyone, regardless of status, age, gender, address. It is non-judgmental, non-clinical and absolutely free. It runs Monday, Wednesday and Fridays from 9 a.m. till 2 p.m. Luke Benham from 42K for 42K would sincerely like to thank every person and organisation who's donated to this cause, by whichever way that has been. Everyone who bought a t-shirt, a hoodie, dropped a coin into a tin, bought a cup, cleaned out their jock drawer and donated the cash, and of course to Anita and Robinvale District Health Services for making it a reality.